my name's Annabelle. My role here is emergency and critical care nurse, and I've been at ERH for just over 5 years now. I was a general practice nurse at one of the Peninsula Vet Cares, the Dramana Hospital. I initially wanted to be a surgery nurse, and I stepped into the emergency and critical care role purely. I was sort of just going to use it as a stepping stone to get into surgery once there was a position open. And then I never left emergency. I found my niche. I suppose the transition was a little bit different to what it is probably now. We were a lot smaller back then. We was just sort of starting out. We didn't really have the intensive cases, I suppose, that we have now. So it was a very slow transition. We really got to ease into it. We had one of our more senior nurses who looked after us and really mentored us through it, because a lot of us didn't have emergency experience at that point. And she just sort of helped us transition and gain our knowledge through that, and a lot of support, some training as well. And then we just gradually grew, and our knowledge just grew with the business, I suppose. I'm probably one of your more senior nurses. So I started off as a junior ECC nurse, and as time's gone on, as it's grown, I've grown, and now I have more younger nurses coming in with little ECC experience, and now I'm the one mentoring them. It's quite humbling, actually. Quite nice. Them being able to be put on with a senior nurse, someone with a little bit more knowledge, it's nicer for them. It helps them be able to learn. If they're not sure about something, they have the support of their other nurse, showing them how to do it, taking them through the steps of doing it, why we do it a certain way. It's better for them. It's better support for them, and you're going to be a better nurse because of your team and your support you get from them. My main love of what I do now is the critical care side of things. I do love the emergency side where everything comes in and everything's chaotic. I do love that. But I love my cases that are really critical, and I take the time on, and sometimes I can spend up to 4 hours with them. It's when they go home. Ones that have been in for 7 days, 8 days, 14 days, and they walk out the door. That's probably one of the most rewarding, definitely. I'm hoping that I can continue down the critical care side of things and gain more knowledge out of that. And maybe one day I wouldn't mind heading into a management sort of role. But at this point in time, I just want to focus on my clinical sort of things. I feel like I've still got a lot of time left on the floor. So that's really my main focus. It's fun. My team, like it's fun. Like, you know, yes, like when we need to work, it's heads down and we work hard. But there's always time for a laugh. There's always time for a joke. And I think it's good. And like, we're very much wanting to keep morale up even outside of work. So we try and do regular catch-ups. We've got a catch-up coming up at the end of the month just for the emergency department to get together. It's fun. And I think, yeah, you feel valued. I would just do it. Make the leap. Just do it. I mean, like, you're not going to lose anything. And you've got all the support that you need. Like, you're not going to be dropped in the deep end and just either sink or swim. Like, people are going to make sure that you are okay and that you learn as much as you can possibly can. No one's going to put you in a situation that you don't feel comfortable in. And it's so worth it. Eventually it gets to a point where you want to learn more, and I'm that type of person. I want to constantly be learning, and I think that's a good thing, especially about emergency, is that it's constantly changing. It's constantly, every day is different. You will have a case, but you may not have that same case for another 6 months. So it's really interesting. So just do it.